Welcome to Pause for the Truth, where you can sit back, relax, and hear an honest dialogue about health, wealth, legal, and social issues. The hosts are Dr. Rogers Kane, family practice physician, and Jocelyn Turner, health education consultant, with co hosts from the Northeast Florida Medical Society and its foundation. Stay tuned for the truth about matters affecting you and your family. We're here to tell you what's really going on and why. Good evening. I am Jocelyn Turner. Welcome to Pause for the Truth. How are you all doing this evening? I tell you what, when life happens, we just roll with the punches, right?
Exactly.
OMG. Dr. Kane, how you doing this evening before we introduce our guest tonight?
I'm rolling with the punches. I'm happy my name is not Rodney King and and some of the other unfortunate beings that run into our guys in blue. So I'm really blessed in that sense, in every sense. To be quite frank with you, my family's healthy and I can't complain about anything. Well, I can, but it won't do any good. You guys don't care.
Well, as the old folks say, no needing.
No need.
You ever heard that? Maybe they didn't say that in the neck of the woods, Dr. Kane, but in my neck
No.
of the woods, they said
I'm from the
no needing
city.
complain. Have you heard that before?
Who, me?
Okay. Is it me? Am I frozen?
No, you're not frozen. You're just delayed off and on. You're getting some
Yeah, I don't
freezing,
see you.
intermittent freezing.
Maybe it's me who's frozen.
No, you're getting intermittent
Dr.
acceptance in terms of
Russ,
your
how
broadcast.
are you?
Yes,
Huh?
yes, ma'am.
I'm delayed. Okay. I'm in a new I'm in a new setting. I'll just share. I am at church. So this is my first night not being at home.
Oh,
Go ahead, take the lead, Dr. Kane.
Okay. Hi, Dr. Russ. How are you?
I'm well, Howard. Well, you shared how you were and how you needn't be, and I was paying attention.
Yeah,
Dr. Kane, go ahead and take the lead.
I got it. I got it. Yeah, it's all. I was just pranking everybody. I'm doing absolutely fine. I can't complain. Um, I'm hoping that all my colleagues are doing the same, friends and colleagues. So, Dr. Russ, I know you're the expert about tonight's topic, so I'm gonna let you introduce yourself. You can give us a brief intro.
Absolutely. So there have been some changes since the last time we talked. So I'm excited to get everyone caught up. Again, I am Dr. Dory Russ, Jacksonville homegrown. When we last spoke, I was the medical director at AIDS Healthcare Foundation.
Yes.
Had had multiple changes in my life. Wanted to be able to spend some time with all the kids. Last time it was one, and he snuck on the camera. Now I'm a mom of three, so I am doing some telehealth, but I'm also volunteering with We Care.
Right.
Taking care of some of their HIV positive patients. So still getting to do what I love. And I'm now an American Academy of HIV Medicine specialist. So definitely
Oh,
this is where my passion is. So I look forward to addressing this topic tonight. There have been a lot of health topics in the news lately, but this is one that still needs the presence and attention that you all are giving it. So thank you for the opportunity.
well, we thank you for coming on. I mean, when I talked to Ms. Turner this evening, I was letting her know that probably the biggest perspective I'm going to give is one more of a historical content because I came along at the time that I remember I was in my second year in medical school, and the pathologist, the lady teaching us pathology, just briefly mentioned, okay, when they were talking about blood and blood disclosures and stuff of that nature. They just made mention and said, "Oh, just keep an eye out for this. There's some new virus going on in Europe, and it's mostly affecting Jews," is what they were saying.
Hmm.
And but just look at it. Just be aware that it's out there. Won't be on your boards, is what she said, and that was it. That's like in 1982, 83.
Okay.
Not to, and then add a few years where I got the residency. And when I got the residency, my first year in residency, I took care of probably the second AIDS patient here in Jacksonville.
Oh
Never
wow.
forget his name. I won't. I'll never forget his name. I got his name buried here. And I remember all the fear that surrounded HIV at the time. You thought there was a lot of fear with COVID. You know, it was with HIV. They were probably about equal, but I tell you, people were scared to go in a room with a person that had HIV. You know, there was a couple. I remember being up on the 8th floor at one of our local hospitals because that's who most of the patients were coming to at the time. It was pretty new. It was a teaching hospital. Obviously, everybody knows it was Universal. It was Universal Hospital at the time. You know, currently UF Health / Shands, and there was a net in the room, just a net, and the nurses were freaking out. You know, because the net was flying around in an HIV patient's room. Fast forward to what we got to know today, or what we know today, and there not only is there a remarkable amount of informational changes that have taken place, but the fear is not as prevalent as it was then, and we know a lot more. And even though we're officially saying uncurable, we at least have a lot of hope for it to reach that
She's
cure
right
stage.
here.
So with that, I just wanted to kind of throw out my little history and my exposure to it. So I'm gonna throw it to you, Dr. Russ. You're muted.
Oh, how am I now?
Okay.
Thank you. Sorry about that. We stand on the shoulders of legends and giants, and you definitely are one in this community. And I thank you for that historical context. You are a legend. Take it, love it. You are. You know you are. We know you are. I was smiling when you said 1983 because that is a very, very special number to my heart. It's the year I was born. So this is a virus that's been around my entire life, right?
Right.
So while you have the historical context, I have the context of I grew up with this. I've gotten to see from having no medication to having preventative medications to now we have injectable medication. So I've got to see everything but the cure. And I still believe I'll see that in my career. So I'm very thankful. I do think it's something that we can't, let up on the gas and not address and not talk about, because it is something that is still impacting our communities. And part of the problem we have is that we either don't talk about it. Well, we talk about it. We talk about it once a year. So thank you for having me. But outside of this, we might not talk about it in our community, or we're not aware of all of the resources that are now available. So again, I want to thank you for that opportunity tonight. So the most important thing that anyone can do is, of course, to know your status, because you can't protect yourself and you can't protect others if you don't know if you're positive or not. And yes, it can be scary. I remember, getting tested 20 years ago when they would take you in that private room after you were to get your results and you didn't know what they were going to say. You prayed, but you didn't know. And you said, okay, I won't do that again, whatever that may have been. But now it's get tested, know your status, get treatment if you're positive. And if you're not positive, weigh and stratify your risk factors and either get on medication to prevent you from acquiring the disease, or, take certain precautions and lifestyle modifications. So what I want to talk about tonight, in addition to the importance of getting tested, and we have National Black HIV testing, which is why you guys are having me. So thank you, is pre-exposure prophylaxis. So when I was here the last time, I was excited about it. We call it PrEP. It's the pill you take once a day. They also have on-demand PrEP where you might take closer to an encounter. But now we have an injectable form where you get an injection once a month for the first 2 months, and then every other month. So we're talking about 6 injections a year to prevent acquiring HIV. And again, if you're in a relationship and your partner's positive and you're negative, that's a great opportunity. If you are, if you have multiple partners or you don't know your partner's status, that's another opportunity where this medication can literally save lives. And along that same vein, another version of that medication can actually be used to treat HIV. So we have patients who were taking 32 pills 20 years ago, thought it was revolutionary to have one pill that they could take now getting an injectable medication once a month or once every other month. So again, the evolution of HIV care is phenomenal. Outside of COVID, we're not going to see anything else like it in my life. Like, again, we saw COVID be developed, we saw the vaccines. So that's COVID is an outlier. But in terms of everything that we saw bread and butter in medical school and residency, we won't see anything else like that, not as rapidly as HIV treatment. But you can't get the treatment and you can't get PrEP unless you know your status. So I'm going to keep harping on know your status, know your status, know your status. I used to say go with a group of friends, find out. Well, no, go with a group of friends if you know your friend group, but sometimes people will share information or you know what, they pull them to the back and not me. So I think so make sure you know who you're going with, but get tested. There are testing sites all around the city. There are plenty of places you can go, the health department as well. And if you're worried about what people might think, there's nothing better than protecting yourself. So, I deal with needles. I've had a needle stick. So I had to take post-exposure prophylaxis, which is medication that you take after you've possibly been exposed to the virus. And so I routinely get tested because I want to know my status. And if there's something that I need to treat, I want to treat it right away. I feel like I've been talking, so I am going to take a break and let you all join in.
No, I think your summary of the from a historical content was excellent, because there was, as you said, we went from no treatment to a zillion pills a day, and it had to be very timely. If you didn't miss, if you didn't do it on time, it was like not having taken it at all. And then you had people back then that had these alarm watches, looked like every 3 hours they were going off, and but the only thing that I would like to add to that, at least from start, is that the other testing place is your doctor's office. Yes. Don't forget, you see, of course, that's what I do, primary care. And I encourage my patients all the time to let's get tested, whether they're married, not married. I wanted them to know their status. And some people say, well, I'm married, it's not an issue. And I say, well, yes, no disrespect to your loved one, but you just never know. And it's best to know what your status is, particularly when they're young and more likely to have kids, whether it's male or female, because even though we don't have kids, you use us to get kids, and we may be able to pass on that HIV virus because of that. And I just employ people all the time, get tested, get tested, get tested. And most adhere to it. Some pretty much adamant about not doing it because of the old fear of being labeled or, I definitely remember back in the days when they didn't even want to talk about it in church. It was a battle to get out there and fight. Go ahead.
Well, I have, when it comes to HIV care and the church, I have a very personal story. So for those who don't know, my husband is a pastor. And so sometimes we will go and talk to LGBT communities together from the spiritual and the medical aspect. So it's just something, it's part of our mutual calling, right? But the reason I'm smiling is because I have an affinity and great respect for pastors. They have a calling on their life that is different than the one on mine. And I pray for them because it's a hard one. Like, they are literally sometimes standing in the gap for people's actual souls, right?
Right.
But just like I respect them and their lane, I need them to cautiously talk about medicine, because I had someone convince their patient that they were not positive, and she actually stopped taking her medication for a time period. Because his argument was, well, if you're coming up and you're testing negative, which wasn't negative, the virus was undetectable, maybe you don't have it at all. And so it's just one of those things where not only do we have to educate our colleagues, not only do we have to educate the public, we have to make sure that people that have this purview and dominion over people's lives are educated as well, so that they're not inadvertently disseminating misinformation.
Exactly. Ms. Turner, you waiting?
Yeah.
So speaking of undetectable.
Yeah, I'm just amazed and astounded at all the things that you've said. Can you hear me?
Yes.
Oh, okay. I'm amazed and astounded at all the new advances in care. And just to give a quick year in review, I remember when the health department first hired its first HIV manager in 1984. So when you talk about years ago, because I started at the health department in 82, but why do you think that, why do we not talk about HIV/AIDS as much anymore? Is it because people know that there are options for treatment and they're not being as cautious as they used to be? Careful, I'm sorry, as they used to be as far as
So
getting exposed?
I think that's more so for the younger generation, that they know that I can take this one pill or get this shot. So it's not a death sentence to them. It's not a death sentence for anyone anymore, but they don't have the memory of it being a death sentence. So they, and again, as you're younger, you're more prone to take more risk in general. So it's
Mhm,
kind of a twofold approach. And then you have people that, again, you know, late 30s, early 40s. Oh, that one hurts to say. That view it as it's not what it used to be, so we'll be okay. So they might have become lax. Like if you
but
talk
how
to
do they
someone
know that?
who was,
How do they know that, Dr. Russ? How do they know about the injectables and all of that? I mean, and I thought that I was knowledgeable, but I didn't know about all the new. They're just getting it from their peers.
um, so they're getting it from their peers, and then we also have direct to consumer marketing with pharmaceutical companies. So
Okay.
depending on what your target demographic is, you might be exposed to that. For example, there's been a lot of push to discuss PrEP or one dose medications in a lot of popular TV shows. So if anybody watched Greenleaf, hate to be a spoiler, but it's off the air now, so I feel like I can talk about it. They
Yeah.
talked about Dovato, which is a once a day treatment regimen. I talked to some of the Dovato reps and I said, you guys must have a marketing budget out of this world, because I'm seeing your product on, like, in shows, not just on the commercial, but in shows, which is good. It's getting the information out, but it's not getting the information out in the full context. So that's part of the problem.
I can concur with that, and I do think that a lot of as you're saying, and both of you have alluded to, there's a certain level of denial. Not me. There's a certain level of feeling of people believing that it's not going to affect them, and that's for Joe or Tom or Dick or Harry or a Harriet or whomever it may be. Anybody but me, it's going to happen to. And then when it if it does come your direction or that individual direction, the first thing is, like most things that we don't want to hear about, is rejection of the truth, or rejection of the validity of the data that been presented to them. You're HIV positive, and nope, nope, nope. I'm not hearing that. The Lord gonna take care of me, and the other, as you know, with your husband, Lord is gonna handle this. I don't have to worry about it. I'm in His hand. I'm putting it in God's hand, not realizing that God already has given them the mechanism by which to help treat and truth be told, escape this disease even before it became a knowledgeable disease. Because the difference between it and COVID is you voluntarily grab this disease. I mean, when you're consensual to with sex and stuff of that nature, under most circumstances. Of course, we got kids and other people that might go, transfusions or pregnancy and stuff, that it might go from that route. But the overwhelming majority, you volunteered to get this disease. Now, not saying what you did was wrong, it's the truth of the matter. You won't get HIV if you don't have sex with somebody that's HIV positive, except for needle sticks and some of the other, uh, I want to say, I don't want to say minuscule, but some of the other non-dominant mechanism of transfer.
But Dr. Hain, one thing that I have to say, I just have to put it out there. And Dr. Russ, although we know that there's treatment for HIV/AIDS, I'm still thinking, isn't syphilis still there? Isn't gonorrhea still prevalent? So, it's not just a matter of protecting oneself from HIV/AIDS. It's also other sexually transmitted diseases that there may not be a one pill or an
You're
injectable
absolutely
for you.
you're absolutely right. And Florida was already a hot spot for syphilis before COVID, but then after after the lockdown, and then everybody got off lockdown, the numbers were exorbitant. And whether or not people quite understand what syphilis is, I mean, it's definitely a curable disease if it's screened for and treated. But if it's not, it can cause very, very, very serious consequences, both in
Yes.
the unborn and in people. And again, we have the evidence from the Tuskegee experiment when it goes untreated, which is even more depressing because it's curable if you get tested and screened, which a lot of people don't. With HIV, we have universal testing now, which is a difference than 20 years ago when you had to opt in. Now, once a year, you're going to get, not once a year, but, once in adult lifetime, you'll get tested, versus syphilis, where you may have to go ask, I need a syphilis test. I need an STI panel. Talk to your doctor, let them know we are not here to judge you. We're here to help you. And if you don't feel like you have the right relationship with your doctor, we can recommend several that can help you with that issue, because we want to make sure that you're taking care of you. And the only way to do that is to be able to have that open line of communication. But yes, you're right. Syphilis, gonorrhea, chlamydia. And again, all of these can have great impacts on the unborn too. So I'm definitely want to make sure that women in reproductive age and their partners are considering this as well.
It just
do you get to add, Dr. Kane, do you, as a primary care physician, are your patients generally asking for a test for all STDs? Do you offer it? How do you know that you need it if you don't know you've been exposed?
Well,
need a test,
I do have some that ask, but I'm a pusher of being tested. Not a drug pusher, just a testing pusher. I believe in making sure that people have an opportunity to be tested for it. I remember the days when I got criticized for still testing for syphilis, because people were acting as if it was like measles and was historical, and you didn't need to test people all the time for syphilis. And I even talk to my patients, and I use the kind of analogy. I say, you need to get your green card. You say, what do you mean get your green card? And the green card, I say, well, for you to be able to
Mom,
not have unprotected sex anytime you get ready with any stranger or anything. But your green card, in terms of knowing your status as it relates to I'm gonna say about 6 of the diseases that Dr. Russ referred to: chlamydia, gonorrhea, HIV, HSV, herpes, because it does have an impact on particular maternal fetal influence, as well as even trichomonas, because it's an STD and it may alert you to other STDs. So I'm every year when it's time for their annual physical, I will ask the patient, do you want to be tested? Will they verify? Do you want to be tested for the diseases out there? And a lot of them will say yes. They say, I'm married. I believe my husband is not doing this, or my wife is not doing this, but verify, as they used to say, verify, trust but verify the relationship. And that's what I tell them, trust but verify. I get it, and I'm not concerned about my partner as much, but I'm still coming in contact with people for the occasional transfer of syphilis from the shaking of the hand. It's very rare. But I remember the days when, if Dr. Russell, you remember when they would, you could get the gumma lesions on your hands and you shake people's hands, and technically you could get syphilis during those active gumma lesions presence, if I'm not mistaken. That's the way we believed, and that's what we did. When I go to church, these days I applaud. I remember when I applauded Barack Obama when he was doing fist bumping, because I still at this day believe in doing the fist bumping. COVID came back and highlighted why we should still do fist bumping if you're going to do it. But they did not know. People don't know that you can get syphilis from just shaking somebody's hand.
So I'd like to remind our viewers that if you have a question of Dr. Russ or Dr. Kane, excuse me, dial in to 888-669-1280 as we talk about HIV and the stigma that affects Black communities. Again, if you have any questions, dial 888-669-1280. Go ahead, Dr. Russ.
No, I was just going to say that while I was expecting, I was, even more cautious than I probably normally would have been, because I didn't want to end up explaining that I acquired syphilis while pregnant because I shook a patient's hand. And it's just one of those things that we take for granted. So yes, you definitely can transmit it via touch. One of the things that I wanted to touch on tonight is we talked about the importance of getting tested so that you can get treatment, but also getting tested can protect your partner, because we now also know, we have the science to prove that undetectable equals untransmittable. So when your viral load is undetectable, when you're taking your medications, you cannot transmit the virus. But that means you have to know your status and that you're compliant with your regimen. You have to know your status. So if you think about it, not only is taking the HIV, the antiviral treatment for you, it's a way of protecting your partner. It's almost like an act of love if you think about it that way. So sometimes if you don't want to do it for you, sometimes if you think about doing it for others, that might be the push you need to get tested and be able to have the treatment that you need that protects you and your partner.
I go back to one more historical point I like to bring back. And I remember the days, anytime you start talking about HIV, the first defense most people had was, I'm not gay and my husband is not gay. As if that was the homosexual transmission was the only way to get it. We fought many of battles trying to make sure people understand this was a heterosexually transmitted disease. And I'm only saying that to highlight what Dr. Russ just mentioned, and that is, granted, your partner, you trust them, and you feel they may not be positive, but again, I go back to that trust but verify. And when back then, we did battle even with Oprah when she came out at one point in time and tried to go back to that undercover. What do they call them? Not
down low.
Yeah,
down low brothers. Yeah.
So I was, boy. I mean, NMA jumped on her. I mean, with both hands and feet, they jumped all over Oprah because, like, it took us years to dispel that myth that is only homosexual. Don't do that to us again, meaning Black folks. Not just Black men, but Black women and Black men. Don't put us in that bottle again, because then we wind up having so many people untreated and the disease was spreading like wildfire.
Speaking of testing, February 7th is an annual day for people for Black, is Black HIV Awareness Day. What that means is it's an opportunity to get tested. Dr. Russ has repeatedly said, know your status. The only way you'll know your status is to get tested, particularly if you know that you were in contact with someone, if you had unprotected sex with someone. You know what you've done, but you don't know what that other person has done. Again, if you're just joining us and would like to ask Dr. Russ a question, and by the way, she alluded to the fact that she was just born in 1983, but don't let that fool you. She has years of experience in this area and very knowledgeable about HIV/AIDS, and she treats or takes care of patients on a regular basis. So please dial in 889-669-1280. One thing that Florida has a lot of, Dr. Russ, and that is senior citizens. I remember that there are pockets of Florida that had high incidence of STDs. Hopefully HIV was not one, but just in case. So for someone who had been married a long time, maybe their spouse died and they're out on the dating scene again, what advice would you give them to protect themselves?
Absolutely. This is one of those textbook examples that they give us, a recent widow or widower. They're no longer concerned about unplanned pregnancy because they're out of reproductive age. The worst thing they remember was, VD, the clap, going and getting a shot for treatment. So they're like, you know what, I'm going to take my chances. But we have to recognize that in 2023, there are things out there that can literally cause lifelong consequences. So you're going to want to make sure, again, you know your status, you know your partner's status. I tell people to go, and if you're willing to be intimate, go and get tested together. If you're willing. And if you're not, well, either way, and to make sure you're using some kind of prophylactic, so a condom, a dental dam, depending on what activity you're engaging in, but you want to make sure that you're protecting yourself. I won't say what part of Florida this is, but there is a part of Florida that is known for their golf carts, and they're known for
That's the one I was talking about.
Yeah, they're very friendly to Ron DeSantis.
People that know, and they're known for their casserole parties. And I made the mistake of asking about the casserole party because I was like, I like to eat. I'm a foodie. Yeah, so the casserole party is when they have a group of women cooking for like the eligible bachelor, and whoever has the best casserole takes the eligible bachelor home for the evening. That's a
Whoa.
casserole party. Yeah. Yeah. So they're all different kinds of ways of mingling, and we're all adults here. That's fine, but make sure you're knowledgeable. Make sure you're protecting yourself. Is the message we want to express.
Well, and some of the older folks take uh, not pleasure, but take light of safety, take comfort in the fact that, well, he's an older guy and he's not likely to be out running around with people who more likely have HIV. I just remind them that we saw a big part of this spike in HIV in senior citizens with the introduction of drugs like Viagra, because it went. He was able to leave that age group, the casserole age group, and step down in terms of age, and step down, and before you know it, he's bringing back to the senior ladies, especially, he's bringing back the threat of HIV, and so we found, I find that I found it funny at the time, but it did not lessen the severity of what could happen if you're not tested and not have your partner tested before you actively have coitus or actively have sex. And even then, still with protection, but at least should that protection falter, you got the backup of the fact that you were negative. So I still encourage the older folks to use condoms and the other protective medicine that or protective gear, so to speak, that we told young folks to use, despite having the comfort in the person's age, because you think they will make wise decisions, but they sometimes make decisions with the wrong head, just like young folks.
So
And then
if you're just joining us, hold on a second, Dr. Russ. If you're just joining us, we are talking about HIV stigma and the impact it has on African Americans. If you have a question of our esteemed guest, Dr. Dory Russ, call in 888-669-1280. Again, 888-669-1280. Dr. Russ has shared a lot of information tonight, and the main one that she's getting what we're talking about now is you can't look at someone and can tell that they are HIV positive or that they have AIDS, right? So the best thing to do is not be shy about having conversations, but we talk about everything else that's going on. So have an honest conversation and don't be shy to bring that up. If you're in a new relationship with someone and you bring it up and they want to not talk about it, and as Dr. Kane said a few moments ago, and say, I'm not gay and yada, 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 then that might not be the best relationship for you, because what you're trying to tell that person is that I am being honest and giving all of myself to you by becoming or being transparent and willing to go and get tested. We can go together, as Dr. Russ said. Dr. Russ, what you were going to say something before I so rudely interrupted you.
You did not rudely interrupt. This is your show. I'm just happy to be a part. No, but I wanted to also mention that we talk a lot about, well, my partner's out there. I trust them. We also have to think about the fact that this can be transmitted via needles as well. And while, I hope whether or not your partner has a substance abuse problem, sometimes people, and especially after the pandemic, have found different ways to cope. So that's another risk factor. So even if you are 100% sure that you're the only one and they're the only one, you also don't know what they do in that free time when it comes to substance abuses and trying to self-medicate. So again, getting tested for a myriad of reasons, but mostly so that you can get treated or get on prophylaxis if you're negative, are very, very important, because you can acquire the virus in many different ways. And again, for the people in reproductive age, you can transmit it to your unborn fetus. Fortunately, if you're tested early and you get on medication, the chances of that are dramatically reduced. But it goes back to one thing and one thing only: you have to know your status.
I want to make sure people understand that Dr. Russ is not saying everybody on this broadcast needs to be tested and treated. Let me put it that way: tested and treated. Yeah, we're not saying that. We're saying everybody on the broadcast can be tested, but we're not saying everybody should be treated. It's some high risk group, Dr. Russ, that in particularly we like to have them be in prophylactic treatment. Can you outline those high risk groups?
Right. So absolutely. So if you have multiple partners, if you are a sex worker, if you are a substance use disorder patient, those would be the people that I would start with. Usually if you're getting good routine prenatal care, you're going to get tested at the beginning and the end of the pregnancy. So that's another way to make sure that we're minimizing the risk of the transmission to the unborn. And then, current statistics say that Black gay males have a 1 in 2, so 50% chance of acquiring in their lifetime. But it's not just them. It's anybody that has partners, multiple partners, again, sex workers, not judging at all, but we just want to make sure that we're able to take care of those vulnerable populations. And again, my perspective might be skewed because that's what I see the majority of the time. So I'm like everybody, but you're right. We want to adequately and use resources so everybody get tested. And then if you're in one of those high risk groups, or if you're in a relationship with someone who is positive and you're negative, that would be another great time for you to get, on prophylactic.
Let me make sure we emphasize also that you get tested, your partner get tested. I don't want you to go and ask your partner, so what's your test come back looking like? Okay, I want them to show it to you. Okay, that's what I mean when I say a green card. Show them your test results. Here are my test results, and then ask them for theirs. Let's share your test results, not just, again, trust but verify. If you want to make sure that you are not exposing yourself, trust but verify and ask to see their results, testing results.
Dr. Russ, there was a question that was posed. Why are the numbers so high for Black females? And is that true?
So I'm going to speak to why the numbers are high for Black females. Black females between the age of 15 and 44 are the highest new cases diagnosed. And there are multiple reasons. So I'm going to give the parallel example of COVID. Before we were even calling it COVID, when it was novel coronavirus 2019, I saw that on a document today and I just kind of shook my head and remembered wistfully, but we were all so naive. It was how we were questioning patients. So we wouldn't even bring it up to you if you hadn't recently been in China, right? Like that had to be one of the things you did to even qualify for being tested. So we, the medical community, the public health community, introduced a bias into the process in the beginning. So if we weren't testing you, then of course, if you hadn't been to China, then of course you weren't going to get tested. So we didn't know that it was going to be in certain communities. Well, it's the same thing with HIV historically. So, 40 years ago, 30 years ago, there was a face to HIV and it wasn't a face that looked like mine. And because it wasn't, people thought that faces that looked like mine couldn't get it. And that was the farthest thing from the truth. But we weren't tested earlier. And even when I started medical school, I remember having a classmate, and this was the late 2000, the late aught. So definitely people knew that we were all at risk for HIV by that point. And her doctor was like, I'm not going to test you. You're not at risk. You're not in that group. You're not one of those. And that was her doctor. And she was like, wait a minute. I mean, I know I might just be a medical student, but that's not what I was taught. Right. So it's great to have advocates, but we have to make sure we have advocates that represent everyone, because when there gets to be a face on a disease, people that don't have that face might be neglected by members of the healthcare community, or they might say, you know what, I'm not at risk. So I'm going to take myself out of being tested. So it's twofold. Historically, we've blamed certain people, and we now know that that's not the case. Every time that you make the decision to be intimate with someone, that is a decision that you're making. My rule is I treat everybody like everybody has everything. So I'm going to use what we call universal precautions. I'm going to protect myself. Because that's, at the end of the day, that's all I can do is protect myself. That's how I got through COVID. Everybody had COVID. So my role was, I'm going to act like you have it. So I'm going to stay away, and I'm going to act like I have it and try not to give it to you. So I'm going to stay away twice. But that's my own neurotic nature. But going back to Black females, it was part of the fact that we just weren't in that target demographic in the beginning. And even to this day, I can, randomly post on Facebook, do you know there's a medication that can help you not get HIV if you're at risk? And, people don't know. People don't know about U equals U, because a lot of those campaigns are targeted at a different community. And so that's why messages like this, shows like this, are so important, because all communities need to get the information. We all need to be aware of the options that are out there.
Dr.
I was
Russ,
having a conversation with some teachers earlier today, and they were talking about, the conversation that some of our elected officials think that it's the parents' responsibility to talk about responsible sexual behavior and all things related to sex. And I shared with them that in an ideal situation, that's wonderful. However, there are a lot of parents that just don't know the facts, right? And so then the teachers countered with, but little Johnny and little Susie is having sex because they're crossing the street going to the middle school and having sex with the middle schoolers, right? And so, I'm reminded that we need to have these real conversations with our children, but and that there are resources and places available for them if parents don't know how to talk to their children about responsible sexual behavior. I have to plug that, and I'm assuming they still do. My former employer, the Florida Department of Health, is a resource. And I want to also ask you, Dr. Russ, in addition to the health department, talk about where people can get tested.
Okay, so we have, of course, the health department. We have there'll be local vans, AHF, AIDS Healthcare Foundation, excuse me. They have a mobile unit that's going out routinely. Every now and then I'll see it and I'll be like, I know them. They go around town. If you're on a college campus, that's another opportunity in your student health network. They'll have places where you can get tested. And again, at your primary care doctor's office, you can get tested. You can ask for that. Again, we talked about getting tested as part of good prenatal care. We know about the maternal health crisis right now. So if you are in reproductive age, make sure that you have established that relationship with a good OBGYN beforehand, because you're going to need the care to get through that very, very special time in your life as well. And then there are different clinics around town. There's the Community AIDS Network, and there is Lutheran Social Services that can point you in that direction. I know even before Google was Google, you could pretty much type in a search engine, where can I get an HIV test? And it'll list places. Now, some of the numbers might be disconnected. They might not be in service anymore, but it gives you a place to start. And then Jasmine, that's another place where you can get testing services as well.
One of the things that I will,
because we're not sending testing kits. I'm sorry, Dr. Kane, I just have to say this because unlike COVID testing kits, they're not sending HIV testing kits to the house. No. So you're going to have to be responsible and pick up the phone and Google where to go and get tested. Go ahead, Dr. Kane.
Well, the men may be a little mad at me for saying this, but I'm going to go out there and say it. I think what may contribute to women being such a high, a high positivity rate is that they do more about their health and getting tested for and being treated at doctor's offices more so than men. You're more likely to see them go out there and seek some truth about their health status just opposed to men. So that may contribute somewhat to the high positivity. Not, it's not an absolute that they're just highly positive more so than men. Is I think most of the time women do more about their health situation and more about their health, seek more about their health status than men do.
No, I think that's a great theory.
Go ahead, Dr. Russ.
No, I was just going to say, I think that's a great theory, whether it be trying to get contraceptives or, getting pap smears. Women do have more encounters with the healthcare system in general. So there are more times to be tested.
Absolutely.
And there was a question posted. Are there any special programs for women, Black women, since Black women are high risk for testing positive for COVID? I'm sorry, you can tell what I've been talking about, for HIV/AIDS. Are there any special programs or support for Black women that are positive?
So there are national support groups for Black women. I can definitely get that information if you guys can share that later, but there are Black female health alliances for HIV positive, because it is a different perspective because now you're a minority within a minority group, okay? Because you're not the face of the virus. You might not be the person getting the resources, and you have a crossover with your community. So there are special groups for that. In terms of testing and treatment, those resources are going to be generally the same.
So if you're just joining us, we are speaking with Dr. Dory Russ. Again, she shared some wealth of information about a topic that we don't like talking about. And yes, it is still real, HIV/AIDS. The good news that Dr. Russ has shared is that there's wonderful treatment now to help protect you, and you can live a long, healthy life. But first, you need to know your status. If you have a question of Dr. Russ and of course Dr. Kane, oh, and maybe even me, dial in 888-669-1280. This is your opportunity behind the camera. No one has to know who you are, to ask the real question. If you don't want to talk, then type it in. You know, what's something that you've always wanted to know about HIV/AIDS and was too afraid to ask? Throughout the years, Dr. Russ, I've met ladies, and I say ladies because I'm a female, and people knew that I worked in public health, so they shared a lot of personal information or told stories. I've met ladies who were married, and all of a sudden they found out, because they were going to get those routine examinations or tests with their pap tests and asking to get tested, or it was offered and they were like, oh sure, go ahead, and they found out they were HIV positive, right? And so, you know, it's a conversation, it's a reality, unfortunately, for so many people. And I think I like to talk about young women. You know, I love this generation. They're so free spirited and just, you know, just very just free spirited. It's okay to be free spirited and be yourself and do what you want to do. But let's talk really about prevention. What's the best way to prevent even being exposed to HIV/AIDS, or at least protecting yourself from being exposed?
So that's a great question, and you're right about the free spirit. I know a couple of years ago we had Hot Girl Summer, which even when I was like younger would not have been a, it wouldn't have been a thing. So I'm happy for them. Do your thing, but again, protect yourself.
Hot girl summer. What is that again? I can't let that pass without figuring out what that
So again, from what I understand, it's about being liberated in every way.
is.
I'm an
Okay.
old married woman now. That's what the people tell me. I don't know.
Okay.
I mean, but we have an art form in rap where people can talk about their endeavors again in a way that might not have been done 30 years ago. So it's in the media. But how do we protect ourselves now that it doesn't have the same level of stigma or shame? So condoms, knowing your status, and if you are going to be liberated in every way and not want to use those types of materials, you would be an excellent candidate for PrEP. Again, it would be either a medication you take orally or a shot, because at the end of the day, all you can do is protect you. And so that's an option. So this is why it's so important to make sure you're talking to your healthcare provider so that you know what's out there. It's our job to know what's out there. It's our job to get the message out via programming like this. So again, thank you. I can't thank you enough for the fact that you guys have the show and you enlighten our community, because sometimes our community gets the short end of the stick. Like, we know that it just does. But again, once you have the information, then it's on you to have that level of personal responsibility. So if you're going to live your hot girl summer 23, 24, and 25, make sure that you have done your risk stratification. You know what you're at risk for, and you take the proper medication, if that is something you choose to do. But like you pointed out, there are other things out there other than HIV. So use condoms too, so that you're not getting gonorrhea and chlamydia and herpes and HSV and being diagnosed with, cervical cancer in your 30s. So protect
And
yourself.
not being and when you contract that, and particularly in women, when you contract the other diseases, you do also run the risk of being infertile, of
Yes.
becoming infertile, because of the destruction that it has among your tubes and your ovaries. To a degree, ovaries, as well as your uterus. So it helps protect your female organs, birthing organs, so that if you plan on having a family someday, you're still able to, without having the difficulties of scar tissues and um, previous infections damaging you to the point that you cannot have kids.
Or even if you have a herpes. I'm sorry. No, I was saying sometimes with a herpes outbreak, it might necessitate you having a C-section and you won't even be able to do a vaginal delivery. So yes, protect yourself. I'm sorry, go ahead.
Because it can blind the kids.
Yeah, we had a question. Are there any legal? We had a question. Are there any legal remedies should you receive HIV from a person who knew they were HIV positive? Are you switching to your lawyer hat because you wear both hats?
I'm not putting on my lawyer hat. I'm going to share the law, and I'm going to give my very, very unpopular opinion after I've shared what the law is. So again, this does not establish, okay, now putting it on, this does not establish a lawyer-client relationship. So this is on a state-by-state basis. If you knowingly transmit the virus in Florida, that is punishable by up to a 3rd-degree felony. Okay. Because the law has not kept up with the science. Now, this is me giving my opinion. The law does need to change, because now we know that even if you are HIV positive, if your viral load is undetectable, you cannot transmit the virus. Should you disclose your status? Of course. Do we live in a world where people do what they should? I'll let y'all answer that. But what those laws do is they tend to actually disproportionately impact African Americans. Those are the people that are usually prosecuted for that. So from that standpoint, if someone is undetectable and cannot transmit the virus, should they be part of the criminal justice system? I don't think so. But there are a lot of shoulds in that. So the law as it is it is punishable by up to a 3rd-degree felony if you knowingly transmit the virus.
Yeah, previously that was, I was gung-ho about, prosecute them.
Yeah, I was too.
There are avenues out there, not only in terms of now that we're knowledgeable, you protect yourself, but also being able to, like you said, that person trying to make sure that they don't pass it on by taking the medication so that they are, the virus is undetectable in their bloodstream. And then do they need to send let other people know that you're dating. You may not stay with them. Let them know that you're HIV positive, and so on and so on and so on. So that's a lot of little ethical questions that surround it now. Before it was pretty, like what you said, Dr. Russ, it was pretty cut and dry to answer before. Right now, I'm not so sure.
So we've neared the end of the hour of our broadcast. And as always, at the end of the broadcast, we like to give our guests an opportunity to give their final thoughts on tonight's topic. Dr. Russ, you've said a lot. We love having you on, and we need to have you on more than just once a year in recognition of National Black HIV Awareness Day on February 7th. But what are your final thoughts tonight to make sure that our audience leave with an understanding of how to dispel the stigma associated with HIV/AIDS?
Well, first, thank you so much for having me, and thank you for listening to my tribe. Now I've made a tribe, so they make noises, so I do apologize, but thank you for being so willing to accommodate that. In order to reduce the stigma, we have to talk about it. We have to know what's fact and what's fiction. Everybody that's listened to this broadcast now is now charged with being an advocate and somebody that can informatively speak about this topic now. So if you hear somebody say something and you've heard that it's not what's the truth, point them to resources, share the information, advocate, whether it be on changing the disclosure laws, whether it be on education, because, in Florida, we have a whole lot of things that we need to talk about with our educational system and what we can and can't talk about. And then in terms of your health, I've said it, I'll say it again, get tested. If you are in a high risk group, consider PrEP, pre-exposure prophylaxis. If you have an encounter whether it be romantic or a needle stick, and you are a candidate for post-exposure prophylaxis, which is 72 hours. So you definitely need to make sure you're, watching the clock tick with that one. Reach out to your healthcare provider, make sure you have that relationship with someone that you feel like you can trust. If not, Northeast Florida Medical Society is full of great doctors that would love to take care of you and can recommend someone that'll be a good fit. And if you are positive, take that moment to process those feelings and get on the treatment you need and live your very best life.
And know that you can live your best life and a good quality of life nowadays. As you mentioned earlier, it's not the death sentence as it used to be because of the great treatments that are available. And if you don't know where to go, as Dr. Russ said, the Northeast Florida Medical Society, which Dr. Kane has talked about a lot over the broadcast, as long as we've been doing the podcast, has some wonderful physicians, including himself. Not that I'm giving trying to promote Dr. Kane, because you don't have to promote Dr. Kane. But anyway, I'll shut up. Dr. Kane, what are your final thoughts on tonight's topic?
I am very happy that Dr. Russ was able to join us. I agree that we should do this more than once a year. Dr. Russ, we kind of gonna put that invitation out to you to come back when you feel it's appropriate, that split year, wherever it may be. It may be June or July. June is usually, is that Men's Health Month, Doctor?
June is Men's Health Month, and it's also National HIV Testing Day as well. So it works. I'll see you guys in June.
That's how it works.
So I think I was supposed to come on last year, and then I ended up, having the twins early. So I think that threw everything off.
But that's okay. That's okay, because the trial was just as important as anything else we've done. So I'm just happy you got a healthy trial. I will, again, thank you for doing it. I encourage people to talk to any of their doctors, any and all their doctors, regardless of color. But I do know that Northeast Florida Medical Society, most of our doctors can give you some poignant advice on getting tested and where to get tested. We may not be the expert in treatment, but we know who to contact as an expert in treatment. And that person, needless to say, is on the line with us this evening. And so I would like to thank everybody for coming this evening and joining us. I know I got patients that listen. And if you have any questions from me, please feel free to do so, because I'm sure going to ask you the question. Have you been tested?
And if you have not gotten tested, please do so between now and Tuesday, February 7th. The first Tuesday in February is designated as National Black HIV Awareness Day. If you haven't gotten anything out of the conversation tonight, have a conversation with your partner. Make sure you know what each other is doing. Be honest. You only want to be in a relationship with someone who's honest and that you are both protecting each other. As always, thank you for tuning in to Pause for the Truth. Thank you for your patience with me as my internet has been unstable here at church. And we'll see you next week for Pause for the Truth. Thank you again, Dr. Russ. Have a good evening, everyone.
Good night. Thank you. One life to live, one life to give.